Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. For expecting moms everywhere, it's a typical question. You're pregnant, now what? Do you change your diet? Do you sleep in a certain position? Exercise less, exercise more? Moms can seek advice from books, blogs, friends, family, you name it. But today, we're getting advice straight from the best source, OBGYNs who are ready to answer the most asked questions when it comes to pregnancy. And we are so glad to have Doctors Carrie Winnecke and Annabelle Mencius. Ladies, good morning to both of you.
Good morning.
Glad you are here. Dr. Winnecke is also the Clinical Service Chief of Obstetrics and Gynecology here at the University of Kansas Health System. And I want to start with some common questions. So, Dr. Mencius, I'll start with you. We talk about eating for two. Is it really necessary to eat for two?
So that is a really common question, Jessica, and we hear that from everyone around us. Those of us who have been pregnant, our patients, they always ask us that. And I think we hear a lot from families saying, gosh, you need to eat for two. That's not necessarily true. And it really is trimester specific. In the first trimester, you don't really need to increase your caloric intake. And a lot of pregnant patients don't gain weight in that first trimester. In the second trimester, the recommendation from ACOG, or the American College of Obstetrics and Gynecology, says to increase your caloric intake to about 300 calories a day. And that's based off a normal 2,000 calorie diet.
300 calories goes like that. That's not a ton of calories.
Exactly.
So.
And in the third trimester, we increase that to 400 calories a day.
And good calories.
And good calories, right. When we think about like a healthy diet in pregnancy, a really good source to look at is myplate.gov, and that is provided by the U.S. Department of Agriculture, and it goes through what healthy options are. When we think about weight gain in pregnancy, it really is dependent on what your body mass index is. And the body mass index is a number that we get based on your weight and your height. We put it in a formula and it gives us a value. And those values fall into certain categories. For persons that are in a normal weight category, so that's a body mass index of 18.5 to 25, the recommended weight gain is 25 to 35 pounds of weight gain. For those persons that are in a BMI category of 30 or higher, then that is classified as obese. And so we would recommend just gaining 11 to 20 pounds of weight gain.
All right, Dr. Winnecke, let's talk about the trendy baby moons. That's kind of the thing, taking that last trip before the baby comes and you expand your family. But what about traveling during pregnancy?
Yeah, so I'm kind of jealous. I really wish this was a thing back when I was pregnant. I have to say, but it is really fun living through a lot of our patients and their trips. You come home and you're like, oh, where did you go? You know, so yeah, whenever we get a lot of questions about travel. I think probably daily in every clinic I have a question about it. And my biggest thing is that I'm going to answer this question as of Friday the 18th for you personally at 8:03 a.m. because the thing about pregnancy is it changes and it can change on a dime. So most of our recommendations really are talking to you as you're sitting in front of me at that time, and it's the recognition that also might change. We don't know, but in general, for a healthy, low-risk pregnancy and mom, they are safe. So typically, what's recommended is domestic travel. So travel within the U.S. is safe up to 36 weeks. I always recommend, that's air travel. And if you're going to be air travel, these aren't really scientifically proven, but things that we tell you are get up frequently if you can, as long as that seatbelt sign isn't on. Consider wearing compression stockings, doing some in-seat exercises. If you're car traveling, get up. Don't go 5-6 hours in that car a long time without going to the bathroom. Most people can't go that long without going to the bathroom anyway in pregnancy, but just common things like that. As far as the great trips international, that is a little bit probably we don't recommend that you travel 36 weeks internationally
because you can go into labor.
Go into labor, and what I always end with saying is that don't go anywhere you don't want to have a baby at. So, that might be different if you're heading to the Peruvian mountains or if you're heading to England. It just depends what's for you, where you're going, and where you would feel comfortable. Of course, if you are traveling, recommend taking your records with you. For our patients, that's just most of them are all on their MyChart. That's on an app, so that's easy, but might be something to think about if you're traveling somewhere or, just if you're going somewhere where a hospital might be. But overall, most of those trips are safe.
Good advice. What about over-the-counter medications? What's safe, what's not safe?
So in general, most over-the-counter medications are safe. Of course, we would want you to consult with your OBGYN physician or other obstetric provider, depending on what your needs are and why you would need those medications to begin with. In general, we try to recommend staying away from what we call NSAIDs or non-steroidal anti-inflammatory medications without, of course, consulting with your obstetric provider. But in general, in a healthy, low-risk pregnancy, most over-the-counter medications are safe.
What about prescription medicines that you're already on?
Yeah, so the biggest thing here is don't stop.
Okay.
Unless you've talked to your physician prior to becoming pregnancy and the plan for you would be to stop while pregnant, please reach out to a physician first. Many times stopping a medication is much more detrimental to your safety and your health as the birthing person than it is to the fetus. So really please reach out. We've seen some pretty detrimental effects of people stopping high blood pressure medications, antidepressants, anti-seizure medications, things that they thought they were really doing the right thing for because they didn't want to expose the fetus to medication, but then having hypertensive crises or having seizures and things like that. So the biggest thing is please ask. You can send, lists of medications that you're on. We can review them. We will go through the risks. Any of that can be done ahead of time. And then the other thing is if you're thinking of getting pregnant, it's a great opportunity to meet with your physician and say, hey, I'm thinking of getting pregnant in the next couple of months or year. I'm on these medications. Is this safe? Because some things we would recommend potentially changing, and it's easier to change to make sure that new medication works best for you prior to pregnancy than already pregnant.
And we do want to note that these are questions that you went and searched, you talked to your nurses, you said,
yes.
What are you being asked daily? And these were some of those questions that would come up. Very important one, and I know I had this question. Can you drink caffeine, coffee? What's the limit?
Caffeine.
Because we need it, let's be honest.
Yes, as Americans and as physicians, we absolutely understand the importance of caffeine in our everyday lives. So for a low-risk pregnancy, the answer is yes, you can have caffeine. What ACOG, or the American College of Obstetrics and Gynecology, recommends is limiting that intake to 200 milligrams of caffeine a day, and that's about a cup of regular coffee. Now, there are some underlying medical conditions, some cardiovascular diseases, or maybe anxiety that we would want you to just not have caffeine in general. But for general population, low-risk pregnancy, absolutely, you can continue caffeine.
Okay, here's another important one. Priorities. Nails, hair appointments, massages, all the things that we love and do to pamper ourselves. And now we're becoming a mom. What's safe? What should we look out for? Are those just myths?
Yeah, in general, most are safe. And that's, I would say, Dr. Mancias, I feel like most things are perfect. I always say pregnancy is not 9 months in jail. And don't think of it that way. We have to get through this 9 months some way. And I think these are things that are perfect examples. So nails, yes, I safe. Go to a reputable place, right? Some place that you feel is clean, practices good technique, perfectly safe in
pregnant
pregnancy.
or
That's
not
correct,
pregnant.
right?
Yeah.
Good recommendations anytime. Hair the same way. We frequently get asked about color and dye, all safe. Perms, although perms are coming back in, I guess, but back in the day, perms questions are more applicable, but perms, those sorts of things. Massage is really common as well, and we write a ton of prescriptions for prenatal massages. First of all, highly recommend them. I think they're great for pregnant moms for multiple reasons, but overall, in general, for a low risk and most pregnancies, they're fine. I would recommend going to or finding a place that offers a prenatal massage. That, to me, that sort of shows that they understand things like you can't be lying flat on your back, or you can't be on your stomach. There are some areas of the body that are not recommended to be massaged during pregnancy. Of course, abdomen, up legs. There is a couple toes that people like to stay away from, those sorts of things. But that just shows that I think your masseuse and your place that you're going understands.
Yeah, they're specialized in it. What about exercise? What should we be doing, not be doing, upping, downing? What should it be?
Exactly. So exercise, we all know the benefits. It can maintain your blood sugar. It will release endorphins. It's good for mental health. And that's true in pregnancy. Usually the general rule of thumb that we say is whatever you were doing in pregnancy or prior to pregnancy is okay to continue, with the exception of contact sports. So activities that can increase trauma to your abdomen or pelvis. And those are things like basketball, soccer, hockey, things like that. recommended activities are things like swimming, stationary bike, light to brisk walking, light aerobics, things like that. Activities that we also recommend against are things that can increase your risk of falling or trauma. So regular bike riding, horseback riding, skydiving, any type of skiing. So water skiing, snow skiing, things like that.
I want to talk about misconceptions. Like, how often should you feel your baby move, from trimester to trimester? Because that's sometimes, the measuring stick of like, okay, my baby's in there doing well. But you say that could slow as it gets closer to time.
Yeah, I think a lot of, the biggest thing here is what we're recommending and talk a lot about is what's normal for your baby. You know your baby best. You know your baby's sleep cycles. I mean, babies sleep like we sleep. If you were watching my movements, I hope that I'm not moving much at 4 to 5 a.m., right? And that would be very different now. And your baby's the same way. Most patients don't feel their baby moving routinely until about the fifth month or so. Sometimes that's a little different the second time around because, earlier you start to feel these little flutters, and I always say you kind of feel like gas. And then you recognize that, oh wait, that was baby, that wasn't gas. So people—
Hard to tell sometimes.
Exactly, right? These little flutters. So sometimes second pregnancies, third pregnancies, people start to feel that movement much earlier. And then, you should feel baby moving daily. And for some babies, they're more active in the morning. Some babies, unfortunately, they're more active at 2 a.m. But each baby is really different. So we really sort of recommend paying attention and understanding what your baby feels. And then, as you mentioned, once you get closer to delivery, sometimes those movements change. And if you think about it, a baby that's smaller has, what I say is, it has the room to do this. So those movements are more big, discrete movements. As the baby gets bigger, the uterus doesn't grow exponentially that much. So you sort of start to feel this sort of thing. So they get to be a little bit more subtle, and that can be normal. I will say that if you are pregnant and you recognize any change of your movement, it is important that that's abnormal to you, and you reach out to your care provider to talk about what to do. Because it's really, you know your baby best, you know your baby's movements best, and that's when we recommend that you say, this is different to me.
Let's talk about inducing labor. When is it necessary? Why might it be necessary?
Yeah, so there are a lot of medical indications for the recommendation for induction of labor. And that when we think about the recommendations of inducing labor, we think, gosh, the risk to the mom in pregnancy surpass the risk of either an early term or preterm baby. And so those are underlying medical conditions, things like high blood pressure, preeclampsia, poorly controlled diabetes, things like that. And so that induction may be recommended. But say low risk pregnancy, then we can talk about induction, and some patients opt to be induced and some patients don't.
Is that what we mean when we hear sometimes moms saying, yeah, I got to choose my delivery date? My kids were C-sections, so they were scheduled because it was going to be a surgery. But can you choose delivery dates and to be induced? Is that a thing?
Yeah, so from 39 weeks and on, really we can have that discussion of the option of induction. And some studies show that induction at 39 weeks does help decrease the risk of needing a cesarean section as well.
All right, let's talk about a couple other things. Constipation, acne. What do we know about that?
Yeah, really common questions. Constipation, is very common in pregnancy, especially just being pregnant. And then also, your prenatal vitamin frequently has iron in it, and iron is extremely constipating. So we hear this all the time. First of all, recommend is the common things, easy things. Increase your water intake. Make sure you have fiber in your diet, apples, bananas, peas, these sorts of things. If that isn't working for you, there are really, again, safe medications like we talked about earlier that we recommend taking, because you can get, behind. And that can be even more painful in pregnancy.
Behind, I like that. Okay, you get behind on doing your thing.
Yeah, so Colace is a stool softener. We recommend that in pregnancy. Some of the other medications like Miralax and different things are perfectly safe in pregnancy too.
Over-the-counter stuff, okay.
Over-the-counter stuff, safe, but really kind of just paying attention to it and not letting yourself get behind can be pretty important in pregnancy.
But not necessarily something you need to talk to your doctor about. It's something maybe you could just regulate
Yeah,
your
so
own at home?
and if those things like water, fiber intake are not doing it, let your doctor know, because there are some things that and again, if you have questions about the over-the-counter medications, there's always answers and guidance that can be given to.
All right, let's get there. Is sex safe during pregnancy?
Sex is safe during pregnancy. There are some exceptions, some kind of higher risk things. So please talk to your obstetrical care provider if there's
that's
a concern.
real fun conversation to have, Doc.
It's actually a really common question. In general, low risk, no complications with your prepregnancy. Yes, sex at any point in pregnancy is safe.
Dr. Whittick said, just go for it. That's what you said. Go for it, right? If you can, do it.
Yeah, I mean, it's not prison for 9 months, right?
Okay, live life. Live life.
Yes.
Okay, good. All right. Well, if you
got here.
That's great. All right.
That's how you got here.
Now we're coming to you, my friend. Okay, if you have questions, be sure to use the chat on YouTube, Facebook. You can tweet us or email us at the Medical News Network. Info is right there on your screen. Let's go over to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. It's Friday.
It's Friday.
What's the count?
Well, again, we're reporting really the numbers once a week at this point in time of transition. Certainly, if the numbers go up, we will change that and pivot as well. But really, this week we've had 7 active inpatient cases of COVID-19. So again, still staying low. We know that probably increased circulation in the community. We've heard anecdotal stories about people we know or other stories about people getting COVID recently. So it is circulating maybe a little bit more. Certainly in the hospital, our numbers are still low, and that's always a good thing.
All right, headline been out. Many people have seen this. CDC published new data last week about long COVID, and good news, it's less prevalent now than it was last year. In June of 2022, 7.5% of Americans were experiencing long COVID. In June of 2023, it was down to 6% in Americans. Why do you think that is?
Yeah, I think that the headline a little bit misleading. I think that is good news. Anytime we can have reduced amount of disease processes or things like long COVID, which affects so many people, that's always a good thing. They looked at 2 study periods for this, one in June 2022 and one in June 2023. For this study, what they found, just as you said, Jess, is that the prevalence of long COVID decreased at those time periods from 7.5 to 6%. However, at the middle point or so, around January, there didn't seem to be too much of a decline. And still, as of January 2023, we still have a pretty good prevalence, unfortunately, meaning that a lot of people continue to be affected. So this shouldn't be minimized at all. But about 1 in 10 people are still affected by long COVID overall. The authors really didn't comment on exactly why that number went down from June of 2022 to June 2023. Maybe different infection control practices, obviously prevention practices such as vaccination, treatment strategies such as the antivirals, but also people who have been, boosted and then infected or reinfected as well could help reduce that rate. Overall, that is good news. Hopefully, as we continue to live with this virus, we will see less and less long COVID prevalence. But again, as we stated right now, it can still affect up to 1 in 10 people who have had COVID-19, and in some cases can be very debilitating and affect their quality of life on a daily basis.
Yeah, sure. All right, thank you for updating on that. I don't normally tell people this, but your face looks a lot better.
Yeah, right.
So
Still got a lot to go, man.
Yeah, okay.
That poison ivy.
If people missed it earlier this week, it was very, very different. You're looking good.
Bad.
You're looking good. All right.
I'm on steroids right now, too. So
Okay. You're
that's
holding
not
up
good
well.
either.
All right. Thanks, Hawk. Thanks. All right. Any reporters with us today? Let's get to our community questions. We got some good ones. Linda wants to know what to look for in a prenatal vitamin. What am I supposed to be reading on the label?
Yeah, so I think, more important than label is it's one that you'll take, right? So I say, a prenatal vitamin isn't going to work by osmosis sitting on your counter or in your purse. You have to take it. So, some of them can be horse pills. And if you don't like swallowing horse pills, it doesn't matter what's in that prenatal vitamin. If you're not going to take it, not going to do any good for you. So, some people want chewables. Some people don't want red dye. All of those things, find one that you're going to take. That's going to be, to me, the most important thing. I've had patients come in and bring me hundreds of dollars of vitamins, and I said that would be really good for the college fund. And so that do what's best for you. But as far as the thing is, to me, find one that you're going to take. It should have folic acid in it, and that's really, in order to be labeled as a prenatal vitamin, it has to have the recommended required amount in it. So if it says it, you'll be good. But the other important thing that people don't realize is you want to be on the prenatal vitamin at least a month before conception. A lot of people think that I should, buy them, start trying to get pregnant, and as soon as I get that positive pregnancy test, start taking my vitamin. It's kind of late. We want you on that prenatal vitamin at least 1 month before you conceive.
I don't think people know that. That's a really good tip. I've been down those vitamin aisles, Dr. Winneke, a lot to choose from.
Yeah.
So is it fair to say that if it's on the shelf, that it's pretty okay to grab whatever's on there? Because there's so many choices. So I think that's what people want to know. How do I know? Is one better than the other?
Yeah, and I don't think one is better,
Okay,
right? So
good.
you need to have folic acid in it, and like I said, for it to be labeled, it has to have the minimum amount in it. I think DHA is important to have in it, and now these days you'll see it labeled real big DHA. But the other things, are common things in it. The question is that do you want the brand with the pretty label, those sorts of things, or not?
Whatever makes you feel better.
Right.
But the prenatal one pill, one and done. You don't need to keep adding other things to it.
Not
Okay.
unless you have other things going on. So if we find that you're anemic with some labs, we might be telling you to take extra iron, or you tell us that you don't drink, any milk, yogurt, cheese, and we think that your calcium might be low. Well, then we're going to add on some potential extra calcium. Or maybe you've had bariatric surgery. Well, then we're going to talk about a couple extra nutrients because you aren't absorbing the same way that other people are. But in general, find one that you are going to take routinely, and that you're going to take a month before you conceive.
Good to know. Yen wants to know, is there a way for moms to avoid constipation, as we talked about earlier, or frequent urination? Is it just part of the package deal?
Unfortunately, those are both very common symptoms of pregnancy, and they're attributed to the increased levels of hormones, specifically progesterone, with the constipation. So maybe not something you can avoid, but definitely something you can do, as Dr. Winneke mentioned before. Increase the fiber in your diet. Stay well hydrated, lots of water, and you may need to take some over-the-counter stool softeners or non-stimulant laxatives.
Sarah wants to know, she says, I was really short of breath near the end of my pregnancy. How do I know when it's time to see my doctor regarding breathing?
Yeah, so shortness of breath is another really common symptom of pregnancy. Your resting heart rate, so how fast your heart is beating just at rest, is more in pregnancy. Your resting respiratory rate, so how many breaths per minute you take just at rest, is higher. So you may notice going up a flight of steps and you're winded, and as long as you rest and your breath is back, then that's great. Concerning signs though are persistent cough, chest pain, if you feel like you have palpitations or it feels like your heart skips a beat, feeling faint. So those are all symptoms that you would want to talk to your obstetric provider about.
Leslie wants to know about this extra strong sense of smell that she experienced. Is that typical, or is that kind of random?
No, it's actually really typical. The hard part is we don't really know why. It's reported by the majority of pregnant patients, especially early, and then it kind of goes away near the end. We think it has something to do with hormone changes, because ironically, menopausal women also report it. So when we go through our times that we see these great hormonal changes, we recognize different smells. So yes, really common, nothing to do about it, not bothersome, but don't have a great fix for it.
All right, what about food aversions? Normally I like certain foods and then I get pregnant and now I don't even want them in my house. I don't want to smell them or look at them. What's up with that?
Right. Very common as well. And some of that's related to this increased sense of smell, to morning sickness, things like that. And you may have that food aversion for the whole pregnancy. Typically that goes away once you deliver.
Let's talk about morning sickness while we're at it, because I had it. My sister, my mother never had it. I had it. I mean, and then like literally the day one of my second trimester, it just like ended. It was really on time when they say you can have it through your first trimester. What is that about, and what recommendations are there for people to get through it?
Yeah, it's the darn hormones again. That's what we say. You know, there's no exact cause other than changes of hormones. And it's really funny because you're right. Most people will wake up one morning and it's gone. And you talk to them like, oh, it was fine, no big deal. But yet you saw them the week before and it was like horrible, but you forget about it really quickly. You know, there's really a lot of gradient of the symptoms that people have. So the first thing that we recommend is just symptomatic relief, right? So, you know, what I say first of all is 90% of all pregnant patients are going to have nausea, 75% are going to vomit in the first trimester. So you're not alone, and it's not abnormal. But thinking about staying hydrated, and there's some, like, I would say more like small things that I talk about. So, you know, cold, sour liquids typically are like tolerated best. So, you know, people that walk in with big like QT Slurpees, like overly sweet, not going to sit really well.
Yeah.
Cold lemonade, cold ginger ale, water with a little bit of flavoring to it, a little bit of lemon in it, or something like a little Crystal Light or something usually works really nicely to kind of calm that stomach. Separating liquids and solids, also, sometimes that just frankly sloshing kind of can do it.
Got it.
Keeping a little bit of something in your stomach will help. So that's like, you hear about the crackers next to your bed. That's just so that you keep something in your stomach. Because again, with the hormones is that we have extra acid in our stomach, and that everything relaxes. So if you just keep a little bit of in there, it makes you feel better. I also say that, you know, no longer, I don't know a pregnant patient that can go have a 3-course meal anymore, right? You just don't eat big meals anymore, but you want to keep something in your stomach. So I recommend snack, breakfast, snack, lunch, snack, dinner, snack. In realization that dinner is now probably a half a sandwich and maybe a half a serving of a vegetable or something. You just don't get to eat things, you know, anymore. As far as if those things don't work, there are over-the-counter things that we recommend, or medications that can be recommended as well. So if there are, you know, patients out there that are not able to tolerate or keep down fluids or solids after trying some of those kind of symptomatic relief, please reach out. There are things that we can help with.
I sucked on Jolly Ranchers from the minute I got up to the minute I went to bed. It was just having like something, that flavor in my mouth, and constantly swallowing, like really helped.
Ginger
little candies.
So ginger candies can help.
Preggy Pops.
Yeah, Preggy Pops.
Preggy Pops. Yeah. Just little things to get you over the mark. What about stretch marks? Is there anything you can take? Any products you can take? I mean, if we just want to talk about the visual, the vanity of it, how do we either get rid of them or
That's something
avoid
we get asked a lot. Unfortunately, there's not a magic cream or ointment that you can use to prevent them, and they're really linked to kind of some sort of genetics.
Yeah.
They really tend to kind of run in families some. It's a really good idea to continue to maintain your skin well hydrated with whatever lotion you were using before, but unfortunately there isn't a magic ointment or cream that will help prevent them.
All right. What about spicy foods inducing labor? Is that a myth? Truth?
Unfortunately, it is a myth. It does cause some GI upset, so you may have some stomach cramps.
Well, that's not fun.
And that could lead to some Braxton Hicks contractions, but unfortunately it is a myth. There isn't really data linking spicy foods, pineapple, papaya, those things, dates to inducing labor.
I know, but I'm sure when you get to 39 weeks, 40 weeks, you're like, I'll try anything.
Especially when you're 39 weeks and 102 degrees out.
Absolutely.
I think people are going to be trying some things,
Bring on
right?
the spicy food, okay?
Yes.
Let's get to our takeaways today. Dr. Witteke, anything I didn't ask you, anything you want women to know as they dive into this journey?
Yeah, no, thanks for having us on. I think it's really important. I think the takeaways are ask questions. You know, for me, the big thing is if you're on a medication, please don't stop unless you've reached out to your physician, because again, most things can be continued. A lot of what we hear are really normal, and I would say ask your clinician what's a resource that you can use. You know, our office uses an app that has frequently asked questions. We ACOG, so American College of Obstetrics and Gynecologists, acog.org, has great patient FAQs on it. Really simple things. That's a trusted source. So, you know, if you can't get an answer, you don't want to reach out to the physician, ask who, you know, what sources your physicians trust and recommend you to be using.
Well, and you use the word source, good sources, because we know late at night, I know I did it. I was online scrolling every little thing that happened to me. What does this mean? What does that mean? And it can take you down the rabbit hole. So make sure you're asking the right people.
Exactly.
Dr. Mancias, what's the takeaway today?
You know, I will agree with everything Dr. Witteke said. I think it's really important to be open and honest, ask those questions, even if you might feel embarrassed with your obstetric provider. Trust me, there's not a lot that we haven't heard. So, you know, just kind of being open. There's not a question that isn't appropriate for your care and what you think is important for you.
No question off limits.
Exactly.
Ladies, thank you so much for being with us on this Friday. Thanks to our viewers as well for being with us. Have a great weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update.
Have you ever heard of a kidney swap? I'm Alexis Del Cid on the next Morning Medical Update. That's how one wife helped her husband get a life-saving transplant when she was no match. Learn how her living kidney donation multiplied. Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.